Hi everybody, my name's Stacy Yarnall, and today we're going to talk about frostbite. I don't know where you guys are from, but here in Massachusetts we have very cold winters, so it's important that we protect ourselves. Frostbite, what is it? Freezing of the body's tissues caused by blood vessels contracting and lacking flow of oxygen. Okay? Usually affects the body parts that are furthest away from the core. Those are your fingers, your toes, your feet, your hands, nose, ears, cheeks. There are 3 different degrees of frostbite. The least severe frostbite is frost nip, usually caused by white patches of the skin on the outer layers of the skin. Then you have superficial frostbite, which also goes on the outer layer of the skin, but it causes more numbing and gets a little bit deeper. The most severe type of frostbite is deep frostbite. This is where swelling, itching, blackness occurs. It affects all of the body layers of the skin and also gets the tissues. If left untreated, amputation might occur. Who's at risk for this? Anyone exposed to cold temperatures for an extended period of time. Also, extremely young and extremely old people. Anyone with diabetes or poor circulation. Anyone who has any kind of heart condition. Or people who choose to smoke or drink during these cold temperatures. While people drink during the cold temperatures, they might not realize that they're getting cold enough, and that's when frostbite occurs. Also, people who do not wear enough clothing, or if their clothing gets wet and they choose to stay outside in the cold temps. How do we prevent it? Dress in warm, loose-fitting clothing, as you can see what I'm doing here. You have a winter hat, okay, usually something that covers your ears. A scarf. Mittens, not gloves. That way you can rub your fingers together. Warm socks, which I don't have on, but that's okay. And if it happens and you're outside for a cold or long amount of time, you need to go indoors frequently. Okay? Also, if your clothing is wet, you need to run inside and change out of them immediately. Notice my little drawing here. How is frostbite treated? When frostbite or frost nip happens, the person wants to run the affected area under warm, not hot water. It needs to be lukewarm water. Okay? Hot water can cause, especially if there's numbness, if the water is too hot, it can cause burning of the skin layers. If there is no hot water available, you can use body heat. For example, if my fingers are frostbitten, I can just place them under my armpits, okay, and hold it there. And that will create body heat and hopefully bring the circulation back. Do not use any type of heating pads. Do not put your fingers in a fireplace. I mean, that's self-explanatory. Those also will cause burning. So the easiest way to treat it is going to be running it under the warm water. For any type of severe frostbite, you want to seek medical attention immediately. Okay? Usually what the hospital is going to do if you get there, they're going to run your affected area under warm water. If you have any types of blisters, they're going to pop the blisters, bandage the blisters. Usually 3 to 6 weeks if it is severe frostbite and the circulation hasn't returned. Then they will talk about maybe some type of amputation. As you can see here, I've placed these are all severe frostbite. This gentleman here, he obviously wasn't wearing goggles. Okay, he has severe frostbite on the face. This is severe frostbite of the toes. And over here, if you can see, is severe frostbite of the fingers. All of these are turned black. They're swollen. So hopefully they don't have to get amputated, but it looks like they might. Alright, so overall presentation, prevention, mittens, goggles, hat, scarf, warm jacket, keep warm. Thank you.